Okay. Hello, good afternoon, everyone. Thank you very much for being on time and for joining us today. So today we'll be sharing some of the best practices, best exercise for seniors. And today's talk will be in English. So the Mandarin talk on the exact same topic will be held next week on Monday at the same time as well. Okay, so if you have friends who speak Mandarin, or then you can ask them to attend next Monday's talk. Okay, so for today, before we begin the talk, we will need your help to mute the microphone while you are speaking to prevent any disruption. And you can also unmute your mic when you are answering the questions or at the Q&A session at the back. And so for those of you who have any questions, you can also choose to place them in the chat box as well. Yeah, and also we hope to see all of your faces. So you can turn on your video if it's possible. And just to let you know, like all other previous sessions, this session will also be recorded and uploaded on the Radin Mas Silver Click Facebook. Okay, so before we begin, let's all take a photo together. Okay, so can everyone turn on your camera and smile while our colleague Housing will help to take the picture. Thank you, Housing.
No problem.
Okay.
So can you help me share? All right, 3, 2, 1. All right, one more. 3, 2, 1. All right, thank you.
Thank you, Housing. Okay. Thank you, Housing. Okay, so just a brief introduction on the speakers we have for today. Okay, I'm Josephine, and this is my colleague Ellen, as well as Jin Yu, who would be sharing with me later. So for me, I focus mainly on a community outreach to identify the needs of the community and also to provide service linkages. Well, colleague Jin Yu is the center manager, and he leads the case management team to provide care intervention for the vulnerable seniors. And for Alan Yong, he's a care manager and managing the CREST team, and he has 5 years of experience working with NTUC Health with the residents in the sheltered home and also seniors with complex needs. Okay, so disclaimer for today's presentation is that it's for informational purposes only, and it should not be considered as medical advice or professional advice. So it is always best to consult the doctors if, like, let's say if you have any health concerns or if about your specific condition. Okay, so today we'll be touching on the following topics. So introduction followed by the health benefits of exercising. And next we'll go into talking about the different components of physical fitness. And lastly, we'll briefly cover some exercise related injuries. And we'll do a quick summary. Okay, so are Singaporeans physically active? So according to a report from the Statistics Singapore newsletter in 2016, they actually did a survey on how active Singaporeans are for the last 3 months. And it showed that 48.3%, and that's nearly half of the population, did not participate in any sports or exercise during their leisure time. And this sports and exercise also includes walking. And meanwhile, in the National Health Survey, HPB actually revealed that in every 10 Singaporeans, 1 is obese. And this obesity rate has been increasing 1% every year. And why is this of concern? Because obesity actually leads to a higher risk of chronic conditions like diabetes and heart diseases. And so it is important for us to keep this obesity rate as low as possible in Singapore. Okay, so these are some of the reasons why Singaporeans do not exercise regularly. So, for example, some seniors may find that too old, or some of them may find that it's too hard to exercise because like they're not mobile. Some don't like to exercise. Others find that they have no time. They're working every day. And also they have the family commitments as well. And some of them feel that there are not enough sports facilities around the community that they're living. And there's a portion of people that feel that exercise will not benefit you at all. Okay, so now I have a small activity. I have a question for all of you. So out of all these actions, can you give me the top 3 reasons? Top 3 reasons for Singaporeans to not exercise. There's no right or wrong here. You can unmute your mic to speak, or you can also type in the chat box. I see the chat's incoming. No time.
Don't have the concept to exercise.
Don't have the concept to exercise. Is that Christina?
Yes.
Okay, thank you for sharing. Okay, so yes, the concept of exercising is also important, like being aware that exercise will actually have all these benefits. And so we hope that from today's session, we hope that we can help you to inculcate these habits into your daily life and try to make small steps of improvements. Okay. So actually, according to the research, they actually showed the top three reasons are that too old and poor health, and also no time because Singaporeans are so busy, right? Always working, and with the family commitments as well. And so we are here today, and hopefully we are able to change some of the mindset on exercising. And sometimes exercising or being active is not as hard as you think it is. Okay, so now we will go through some of the important exercise terms. I know they're all very technical, but I would not go through all of them. So I'll just pick out the more important ones. Okay, so most importantly, what is exercise? So exercise is actually a planned, structured, and repetitive movement to improve or maintain your components of physical fitness. Okay, so what does it mean to be physically fit? Okay, so when you are physically fit, you are in a state where you have a low risk of premature health problems, such as your chronic conditions, and you have the energy to take part in a variety, like lots of physical activities. Okay, so there are actually different types of exercise that you usually hear. So there's an aerobic exercise training over here. So it actually involves like your body's large muscle groups. So for example, they are mainly found in the trunk of your body. And so the examples of aerobic exercises are like brisk walking or cycling, activities that require you to use your mostly your entire body. And then next, we also another one that you hear is the resistance exercise training. And so for that, they are exercise that causes your muscles to work or hold against an applied force or weight. Okay, so for example, to put it very simply, so example of this is the resistance band exercise. So actually they have different resistance. Some bands are lighter resistant than others, and all these helps to, when used the right way, it helps to strengthen your muscles. Okay, so now I'll move on to some of the health benefits of physical activity and exercise. Okay, so it's actually proven by many research has shown that exercising actually helps to delay death, and it also helps to reduce the risk of developing chronic heart diseases, stroke, type 2 diabetes, and also some forms of cancers. And how they do that is actually by lowering your blood pressure, helps to enhance insulin sensitivity, and it also helps you manage your weight also lah. And also, most importantly, it also helps to preserve your bone mass. So it helps to reduce the risk of falling down, okay, so that your bones will not be so brittle. And actually, other than the physical aspects, exercising can also help to prevent or to improve mild and moderate depressive disorders and anxiety. And it also makes you feel more energetic generally and increases your overall quality of life. And it also actually helps to lower the risk of cognitive decline and dementia. Okay, so after all that I have shared, now I have a little case scenario of Stephen, who is 60 years old. Okay, so as I go through the next few slides, some of you may find that the below situations will sound familiar. Either you find that you're also experiencing the same thing, or you've heard your friends who are older that might also have experienced the such situations. So as I go through the talk, maybe you can think about some daily experiences. Okay, so 4 months ago, Stephen realized that he could no longer climb the overhead bridge without stopping like he used to 3 years ago. So after he climbs a few steps, every few steps, he has to wait for a while to catch his breath before he continues on. And he also observed that he pants a lot when he tries to walk slightly faster. For example, trying to catch the bus or going up the MRT. And at the same time, he also finds it difficult to bend over to pick up the toys on the floor when his grandchildren comes over. So for example, when walking on the ground, there are also uneven patches, and especially when you walk across the grass patches, and he always finds himself losing his balance many times. Okay, so because of this, Stephen has decided to start brisk walking for 30 minutes 4 times a week in the evening, and enrolled himself in Tai Chi classes every Tuesday and Thursday morning. And after a gradual period of time, he found himself feeling younger and having more energy to do the things he enjoyed. Okay, so as we age, we often find that our energy levels are dropping. So some of us may think like, I am old already, that's why like that, what to do, right? And yes, while it is true that aging causes decline in our physical fitness, but it does not have to stop at this stage, because there are small steps that you can take to make some improvements in your life. Okay, so now that I've talked so much, okay, we will go for a short 5 minutes break.
Yeah.
And my colleague Jinyu and Ellen will continue to share about the 4 components of physical fitness and how we can work on improving each of the component. Okay, thank you. 5 minutes. We'll see everyone back at 2:23. Okay, thank you. For those of y'all who have come in, we are going to have a short 5 minutes break right now. So see everyone back at 2:23. Okay, thank you everyone. Welcome back. It's 2:23 and okay, so Jinyu will continue to share the 4 components of physical fitness.
Okay, thank you so much, Joe. So thank you all for joining us again today. So today I'll be sharing with you all more about physical fitness. So firstly, I'll be going through with all of you the 4 components of physical fitness that are crucial and very important to maintaining our everyday health. Okay, so the 4 components are cardiorespiratory fitness, okay, muscular fitness, flexibility, and neuromotor fitness. Okay, so firstly, these terms might be very technical, so you might not understand them, but don't worry. I will be going more in depth into these 4 components, and along the way, if you are unsure, you may just feel free to ask questions at the end of the session, lah. Okay. Okay. So firstly, cardiorespiratory fitness. This refers to the ability of the heart and lungs, okay, to supply oxygen to our muscles during sustained physical activity. Okay, so this particular fitness is very crucial to our health because it improves our insulin sensitivity and glucose regulation. Okay, so all in all, it reduces your risk for type 2 diabetes. Okay, it also protects you against heart diseases, increases your bone density, lowers cholesterol, reduces blood pressure, and of course, it also helps you to sleep better at night. Okay, so what are examples of cardiorespiratory exercises? Okay, such activities include things like walking, cycling, okay, swimming, and as well as climbing the stairs. Okay, so if let's say you're getting on in age, a bit harder to do things like cycling, which can be a bit more impactful. You can opt for walking, swimming, or maybe even climbing the stairs. Climbing maybe 1 or 2 flights every day will also do you some good. Okay, so that was cardiorespiratory fitness. Then now I move on to muscular fitness. Okay, so muscular fitness, this particular fitness is crucial in maintaining your body's mobility, and it allows you to continue to use your muscles for years to come. Okay, so by increasing this muscular fitness, you will help yourself increase your metabolism, okay, delay age-related losses in bone mass, because as we all grow older, our bone density and bone mass will decrease, resulting in osteoporosis. So if you are able to tone your muscular fitness, you are able to reduce the risk of osteoporosis, and then in turn, it also help to reduce the risk of falling. Okay, and we all know that falling is very dangerous, especially for older adults. Okay, so for muscular activities, if you are interested, you may consider these examples, which are using resistance bands and doing body weight exercises. Okay, so generally we are looking at about 2 to 4 sets of 8 to 12 repetitions, ideally 2 to 3 times a week. And then whenever you do such exercises, especially for muscular fitness exercises, you have to keep in mind that your exercises should be done in correct form and technique, using the proper breathing technique. Okay, so the most simple thing to remember is to exhale when you are exerting. Okay, when you kick, you breathe out. Okay, very simple. So when doing such exercises, you always start with the lower weights, and then you increase gradually over 2 to 3 weeks until you are more familiar with the exercises. Okay, it's always better to start low, figure out which threshold you are comfortable with, and then slowly work your way up. Rather than you just don't get kiang basically don't get kiang and start too heavy okay. So also, if you are unsure how to use the equipment or how to do the exercise correctly, you can consult your fitness trainer or coach who is conducting the session. Okay, so after muscular fitness, we have flexibility. Okay, so flexibility is also very important for the human body, even at old age, right? It allows us to continue to bend down, pick up things, because you always hear older people saying, "Oh yeah, the back pain cannot, very hard to reach out for things, take the things high up on the shelf or reach down to pick up things So if you're able to maintain your flexibility as long as possible, then you can continue to be independent in all these aspects. Okay, so flexibility exercises are those that lengthen and stretch your muscles. So doing so can help in preventing your injuries. Okay, prevents back pain and any balance problems by increasing the range of motion around your joints. Okay, so muscles that are shortened due to overuse or underuse can change the way joints move. Okay, and then this limited range of motion will lead to pain, higher risk of getting injured, and poor overall performance. Okay, so every time you watch TV, then you will see elderly, senior citizens or elderly people are doing a lot of stretching. Okay, so these are examples of how they maintain their own flexibility. Okay, so such examples are quad stretch, hamstring stretch. All these are the very technical muscle terms, but it's basically stretching. Okay, everything is about stretching so that you can keep the muscles flexible, and then allow them to continue to keep their range of motion. Because the more you don't use your muscles, the more you don't stretch, your muscles will slowly become harder and harder. Okay, and then as they become harder and harder, more Chinese is 僵硬 become harder, and then you'll find yourself, your movements will become more rigid, and then very hard to. Last time maybe you could take like bigger strides when walking, but then you might, because your muscles harden, you will find that your walking speed may be slower because you have to take like a lot more smaller steps. Okay. So these instructions will be things like you hold the stretches for 20 to 30 seconds. Okay, so you stretch a particular muscle group and then you hold it for 20 to 30 seconds. For older adults, you can hold it more for a longer period, maybe 30 to 60 seconds. Okay, then you can also repeat the exercise 2 to 4 times. Best if you can do this stretching minimum 2 to 3 times a week. But of course, if you do it every day, then of course you will be able to reap the maximum effects. Okay. Then also do keep in mind that to stretch when your muscle is slightly elevated from a light warm-up or exercise. So it's like you do the warm-up already, and then you can proceed with the stretching, okay, for maximum benefit. Okay, so after flexibility, we come to your neuromotor fitness. Okay, very technical term, but don't worry. The neuromotor fitness refers to your ability to correct yourself should you trip over or lose your balance. Because you know, when you're younger, right? You know, sometimes maybe when you walk, then you trip over something. Your other leg can still go ahead of you and keep you standing instead of like totally falling flat on your face. So this is our agility and our reflexes. Okay, so this neuromotor fitness aims to improve our ability to regain our balance should we fall. Okay, so of course such fitness is beneficial for preventing falls and injuries at any age, but because the elderly population is very prone to falling, this is especially important for the elderly population. Okay, so neuromotor exercise training can help to improve agility, okay, your balance, your proprioception, and other motor skills which can significantly help performance. Okay, so this can greatly benefit athletes and active individuals competing at any level. Okay, so such activities recommended to improve this neuromotor fitness will be things that you're quite familiar with. Okay, things like Tai Chi, dance, Zumba, okay, trampoline classes. Okay, then such neuromotor fitness is also called functional fitness training. Okay, so all these exercises that you do like Tai Chi, Zumba, things like that, they incorporate motor skills like balance, okay, coordination, your gait and agility. Okay, so all these skills come together to improve your own balance, agility, and muscle strength. Okay, very technical, but don't worry. Okay, so basically this is just telling you that exercises like Tai Chi, Zumba, and dance helps to maintain your balance, helps you to maintain your balance and prevent you from falling down. Okay, very simple. So follow these instructions 2 to 3 times a week if you're able to. Each session lasts for at least 20 to 30 minutes for a total of 60 minutes a week. Okay, but all this number of times and the duration are just general guidelines. So of course you go according to what your body is telling you. Okay, and always do it at your own comfortable pace. Okay, so there's actually no evidence available concerning the number of repetitions needed, the intensity or optimal methods. Okay, but the most basic thing is you just listen to your body and follow your own body's pace. Okay, so with regards to those components and their exercises, right? If you do engage in such exercises, then it's inevitable that sometimes you will experience exercise-related injuries. Okay, so this section is to share with you guys more information on how to manage such injuries. Okay, so there are various types of common musculoskeletal injuries. Okay, mostly if you are doing leg exercises like dance, Zumba, Tai Chi, likely is the leg because most seniors, they experience a lot of leg related problems like stiff knees, maybe sprained ankles when they fall down. Okay, so the common types are like muscle strains, okay, ligament sprain, tendon tear. Okay, this in more serious cases we have the dislocated joints, fractured bones, and cartilage wear and tear. Okay, so for sprains and strains, okay, very common for everyone regardless of age. Okay, so a sprain is a stretch or tear of a ligament, okay, whereas a strain is an injury to the muscle or tendons. Okay, so these tendons are the fibrous cords of tissue that attach our muscles to the bone. Okay, so similar to sprains, a strain may be a simple stretch in your muscle or tendon, or it may be a partial or complete tear. So even though you have a strain, it can either be very minimal, or it can also be very serious. Okay, so there's a range lah. Okay. Okay, so and then of course we also come to the acute injuries. Okay, so acute injuries include things like a sprained ankle, a strained back, and all these injuries usually occur suddenly during activity. Okay, so you might be doing Tai Chi, you swing left and right, then suddenly your back suddenly very painful. Okay, so this is an example of an acute injury. Okay, so signs of an acute injury actually include the following. Okay, sudden severe pain. Okay, you might find swelling. Okay, then if it happens on your leg, you will find that you're unable to place the weight on the lower limb. Okay, find it very difficult to put your leg down on the floor, one particular leg. Okay, extreme tenderness in the upper limb, especially if let's say you dislocate your arm, then you'll find that your arm will be very painful. Okay, inability to move a joint through its full range of motion. So if let's say maybe last time your arm can go all the way up, maybe you might find that your arm can only go maybe like that. Then any further up, it will be very painful. Okay, extreme limb weakness, and then quite obvious if you dislocate your shoulder or your joint, the whole thing will just come out, or you break your bone. Okay, so just now acute injuries that happen suddenly during the exercise. Then of course we also come to our chronic injuries. Okay, so chronic injuries usually result from overusing of one area of the body while playing a sport or exercising over a long period. So of course this is not just limited to playing sport or exercising over a long period. A lot of seniors, they also have chronic injuries due to various factors, such as incorrect posture. Okay, maybe the incorrect use of furniture at home, so which results in them, having the incorrect posture, maybe when watching TV or what, the sofa can be maybe too soft, too different height, so making them sometimes have to hunch, and then it doesn't provide adequate support to their back, which is why some seniors sometimes they experience chronic back pain. Okay. Okay, so the following are signs of a chronic injury. Things like pain when performing the activity. Okay, maybe for seniors with chronic back pain, they might find themselves feeling very painful when they are trying to stand up. Okay, then they find themselves having to hunch a bit, right, instead of being able to stand straight. Because if they stand straight, then they will experience a lot of pain. Okay, or they might also experience a dull ache when at rest. Okay, the reason for this is because the muscle itself is already damaged. So as long as it is not given the proper conditions to repair and recover itself, then it will continue to be aching like that for a long period of time if they don't correct this. Okay. So, and then of course swelling as well. Okay. Okay, so we all might have we all might experience such injuries when we do exercises or in our daily lives. Okay. So what do we do in the event of an injury? Okay, so despite whether the injury is chronic or acute, do not try to work through the pain of an injury. Okay, because the pain is your body's way of letting you know that something is wrong with the particular part of your body. So whatever you do, do not continue with that particular activity and just stop. Okay, because if you continue with it, then it might cause your body further harm. So, but when then do you know when how and when do we seek medical treatment? Because you see doctor now, this is very expensive then you don't want a small little thing, then just go walk into the clinic because $50 just fly away, right? Okay, so when do you seek medical treatment? When the injury causes very severe pain, okay, very intolerable pain, swelling or numbness, that you totally cannot feel your legs or your arms anymore. Okay, because I've experienced this before. When your joint is dislocated, sometimes it will interfere with your blood flow. because your joint is out of place. So you'll interfere with your blood flow. And then you'll experience quite a bit of swelling, and you'll feel very numb. Like you totally cannot feel the dislocated. Okay? Like the pins and needles like that. And then you totally cannot tolerate any weight on the area. Okay, you'll find that you cannot totally put your leg on the floor. That's why those people, when they buy car, they injured their leg, sprain their ankle or what, they cannot. It's very, very painful when they put their leg on the floor. Okay, and then you can also seek medical treatment when the pain or the dull ache of an old injury is accompanied by increased swelling or joint abnormality. So you might have an old injury. If this happens at a site where you had an injury before, then this could mean that there's an inflammation or like because sometimes when you sprain your ankle once, it's actually easier to sprain it again because the joint, the tendons protecting the joint area is already loose already. So that's why people who have dislocated shoulders or sprained ankles or what usually have a higher chance for it to become dislocated or sprained again, right? Okay, because the joint there is loose already. Okay, so if you decide that if let's say those symptoms are not present, like the pain is still bearable, and you decide, okay I don't want to eat chicken rice for the rest of the week, I want to save some money, okay, then you try to treat it at home. Okay, so this is like a basic injury first aid that you want to try first at home to see whether it can help. So you can consider these 4 steps. Okay, so if you do not have any of the symptoms mentioned earlier, you can treat the injury at home for the time being. Okay, but if let's say these symptoms or the pain worsens, then of course it's best to check with your healthcare provider. So these 4 steps that you can take at home immediately after injury consists of rest. Okay, rest just means don't move. Okay, just stop and then just stop the exercise basically, and then you apply the ice pack. Okay, and then you compression refers to you compress the injured part with elastic band. It means you really press the ice against your injured area, and then you elevate it. Okay, elevate means keep it up, keep it up. So if your leg is the one injured, you also keep your leg up. Okay. Okay, so on top of those 4 steps, you can how else for you to recover properly from exercise, right? You can also hydrate until your urine is clear. Okay, like just now like that, apply ice packs on tired muscles and joints within a few hours from workout. Okay, no hot bath immediately after exercising. Okay, stretch while your body is warm, and make sure you have enough sleep. If let's say you have some money, again, you can consider doing a sports massage, but of course, not necessarily optional if you want. Okay, active recovery with recreational non-impact activities. So maybe for example, you play soccer already, very, very high impact, right? And then because you very long never play soccer, so your legs maybe very aching the next day. Okay, so you can consider just maybe continue walking, maybe just take like brisk walks here and there, So although the muscle might be aching, you continuing to keep active in that sense by using your legs, but not using those high impact activities can help your muscles to recover also. Okay, proper nutrition, and of course you can also, if you have these at home, you can also use compression garments. Okay, especially for those people with loose joints, because such garments, they help to keep the joints or anything in place. Because sometimes when you play sports, can be very kanchiong. So you want to win, right? Then you go all out. Then your leg sprain, your arm come out, So by using all these kind of garments, then of course it helps to keep the joint in place, Okay. Okay. Next.
Okay, wait. So sorry to add on to Jinu's point on how to recover properly from exercise, right? Okay, so what other things you can do to also help to minimize any injuries? Because not that every time you exercise, you have an injury because you can minimize the risk of getting it. Okay, so to add on, you can also wear supportive gear. So for example, when you exercise or you go for walks, it's very important to wear supportive footwear, and don't wear slippers if you want to go and take a long walk. And also, it's also very important to have the correct form and posture when you are trying to follow, for example, exercise videos, because now there are a lot of exercise videos going on, and sometimes if you do it at home and if you don't do it correctly, it's also very easy to cause some injuries. So it is important to listen out to the instructions given by the instructors in the videos, or if you can also participate in like exercise classes in the nearby CC or active aging center. So over there will be instructors in the front to help to correct your form as well. And you can also, I think Jinju also mentioned that when we start to exercise, we want to pace ourselves. Children or your family that you want to exercise every day, Monday to Friday. Okay, so let's say if you haven't exercised in a while, this is going to be quite exerting on your body. And so let's say maybe when you want to start, you can start slower. Let's say 1 week you can start like 2 times or 3 times a week, and then you can slowly increase the intensity and the frequency as well. Okay. Okay, so next we will move on to watch a video by MCCY, and yeah,
when we exercise, I become a bit healthy in the sense that I don't feel lethargic. So, it motivates me a lot that we want to come down every morning. And the circle of friends getting bigger and bigger.
我退休是为了我的孙子出世。那到了他上幼儿园大概2岁的时候，没有地方去，有朋友介绍说这里有一间 Pacific Activity Center， 那就开始参加他们的运动。
They have this, we play with the games, and then we will relieve our stress when we're in the pool because it's light.
那其实我有那个膝盖痛的问题，医生也曾经跟我说过，如果能到游泳池水里面走动是很好的。
We seniors, when we retire, everybody don't have a full income. So if there is a free gym, of course, we would like to go. Everybody would like to enjoy. And we also encourage a lot of people will go there. We hope everybody will come out of their home and then be more happy. And then at least they can spend their time more outside rather than staying at home, you see.
我希望能回馈社会，然后鼓励多一些乐龄人士来参与我们这些运动。
Okay. Okay, thank you everyone. Okay, so now this is the summary of what we have presented today. So importantly, to exercise regularly and to stay fit because of all the benefits that exercise can give, which helps to reduce the chronic conditions, and also the 4 components, just to recap, of physical fitness. It's the cardiorespiratory fitness, muscular fitness, neuromotor fitness, and flexibility. So you want to work on all these 4 components together to stay physically fit. Okay, so and just now Jinyu also mentioned 2 main types of sports injuries, acute and chronic, and he also went through some basic injury management, such as the rise, rest, ice, compress, elevate, and also to we have some tips on how we can recover properly from each exercise session, so to prevent any injuries. Okay, thank you very much, everyone. So while we are going to, we have a bit of time, and we are going to do the Q&A session. And meanwhile, our colleague Ellen will be sharing the evaluation link. So Housing has shared already, and so we'll appreciate if you can help to fill out the feedback form so we can improve on our future talks. Thank you. And the floor is open. So anyone has any questions, you can feel free to ask, unmute yourself, and also type in the chat box.
Okay, good afternoon, Josephine and your team. I want to ask, just now that gentleman says exhale when exerting. When you exercise, when to inhale, when to exhale. When you breathe in, the time you lift up the hand. When you breathe out, that means your motion go down. Is it that's what he means?
Okay. May, right?
Yes. Hi.
Thank you so much for your question. Okay, so for that's for muscular exercise, right? So it's so you have to remember when you are exerting. So exerting means like when you are using strength. Like for example, maybe you are lifting weights. Don't have to be heavy one, light weights, right? So when you are lifting weights, I show you. Okay, so when you're lifting, let's say you do bicep curl, right? So when you do this, exerting, then you exhale. So it's like like that.
Oh, that means when you exert, you breathe out.
Yes, correct.
Breathe out. So when you raise back your hand to original position, you breathe in.
Yes, correct.
But I always thought breathe in first before you breathe out, right?
Oh no, because when you breathe, you don't want to be breathing in when you are exerting, because it will cause like 内伤,
Cause what? Sorry.
It will cause like internal trauma to your body.
Oh,
because
okay.
Because when you kick, and then you keep your breath in, right? You are like increasing your own blood pressure. It's like you try, because people, they have the tendency to, when they trying to kick, they're trying to exert, right? Then they right. Then you'll keep a lot of you'll keep a lot of like tension in your body and your muscles.
Okay, so when you do the resistance band, when you push it out the band, that one is you use strength, so you exhale, in other words.
Yes, correct.
Okay, when you release, then you inhale.
Correct. So every time when you use strength,
when I pull, I inhale. When I go back, I exhale. So it's like the reverse. So it's
Yeah,
okay.
you try when you exerting, then you exhale. You see whether there's a difference or not.
Okay. Then you said climbing up the stairs is a form of exercise, but old people cannot climb. So you will injure the knees further. Is it climbing up better or climbing down? Will it affect the knee?
Okay, actually, climbing down is harder.
I thought it's easier for old people.
Okay,
you have to exert strength.
It's easier, I mean, because we all find that in general, when we go down the stairs, it's easier, right? Because don't have to waste much effort,
Yes.
But okay, so there's a difference when you are climbing up and when you're going down one. So when you're climbing up, you are using more of your thigh muscles.
Okay.
So there's a right, because when you go up, you have to use your leg has to go up, so there's a right angle, right? But the thing is that when you're going down, it's more like your joints. So people, when they usually fall from the stairs or anything, because their joints are weak, which causes their knees to buckle, and then there's a chance of them just falling off the stairs.
Oh, so it's more dangerous climbing down, but not so that it affect your knee worse than when you climb up, right?
Because when you're using your knee, when you go up, you are working the muscle, you're using the muscle. So different muscles, because when you're going down, you don't really use your knee muscles. Your knee, not say your knee muscles, your thigh, sorry.
Sorry. When you're going
sorry, when you're going down the stairs, you won't be using your thigh muscles that much as compared to when you're going up. So it's like a different set of muscles that you are working.
Okay, when you go down, that means mostly you use your knee, so that's why it's bad for the knee.
Yes, correct. So so if you keep going down, I mean, even though you feel that my muscles I'm not working my muscles, it's fine. But actually most of the impact has been on your knee itself already.
Oh, okay. So in other words, climbing up is more what you call that healthier.
It's more xiong. It's more you can feel that your muscles are very tired, very burning or what lah. But at the same time you are exercising them lah. So of course you will feel the benefit lah if you continue to do this. But of course, if let's say for those elderly really very difficult to climb stairs, then of course we advise not to lah.
Yeah, because most people elderly when they climb stairs they're very breathless,
that's why yeah, like when they climb overhead bridge, right? Like you mentioned,
they're very breathless. So that
correct,
is the hampers there, and they have to stop and rest. So if they manage to stop and rest, is this still a healthy form of climbing for them?
Of course, if let's say because sometimes they both pain, right? They have to climb the overhead bridge. So I mean, sometimes they if they can stop and rest, then of course they have been exercising lah, because they feel the chuan they feel the breathlessness and things like that. So all these are like the effects of exercise lah. But at the same time, we also want to advocate for their safety also lah. I mean, no point they do so much exercise then that should something happen .
So I reckon, you see, when the elderly people, when they jog, they are breathless. They normally walk, they don't jog.
Correct.
When a person, when you do the treadmill, like in other words, stationary running, they won't feel breathless. Is this good form for the elderly if they do stationary running? Just like, because that will culminate in more heartbeat and more, more MVPA. So worried that for the elderly if they do stationary running?
Stationary running, like as in on a treadmill.
Treadmill,
I think in general, treadmill, I mean, okay, this is just my own personal opinion, because but I think in general, you might find that running treadmill slightly easier because the impact on your knees might be lesser as compared to when you run outside.
Okay.
Because when you run outside, the ground is stationary, so but treadmill, the thing is moving. So it helps to lessen the impact. So you might find yourself being able to go for a longer distance and then not so chuan when you run on the treadmill . So like what you said, it might also be beneficial for the elderly . But when they are at the older age, usually they won't indulge in running already . I think more like what you said, they tend to do like maybe brisk walking or less impactful activities.
No, but I noticed that when some do brisk walking, they're still breathless. But when they do stationary running, not say per se on the treadmill, but on just the ordinary ground, they're not as breathless as when they do brisk walking. So is this harmful to the elderly, to the knee?
I think this one is very subjective also. It depends on their own posture. Like even like if you don't like running is beneficial, right? But if let's say you run with improper shoes, or if you run with the improper posture, then it's all these improper things that make the exercise like not as good, not as beneficial. So actually it's very subjective also from person to person. Correct. So I mean, of course, maybe to some people, they can run on the station, they can do stationary running better than they do brisk walking.
So that is okay lah.
Yeah, it's fine. As long as there's no pain aching and all those is normal. As long as there's no sharp pain when they're doing it.
Sorry, can I ask one more? You see, when a person has rotary cuff tear or tendon tear in the arms, how to improve the range of the muscle movement, the arm movement? It's very pain every time you turn in the wrong position. The sharp stepping pain. But understand that when there's a tear, tendon tear or they cannot be healed, right? Once a tear is a tear. How to improve the range without causing any sharp pain?
Okay. So the tear is when you overexert your range of motion.
Fall, because due to a fall, so there's a tear. So how to but you cannot heal because a tear is a tear. So how do you improve your life, mobility without every time feeling all this sharp pain?
So you're still do you go for any physiotherapy like after your fall?
Yes, but after that is not that so I think it's the exercise that it helps, what sort of exercise that is good for that. Doctor said they
Okay.
cannot do anything. If a tear is a tear, you know.
Correct. So my own limited experience, because I last time also got tear before lah. So mine was while running . So maybe because I was still like younger then, so maybe the rate of recovery is different when you're at a younger age as compared to someone who is older lah. Then of course it also depends on how much of the tear your muscles went through lah. Those very jialat one, then of course take longer time to recover. But my experience is, I think I had to go and do a lot of those resistance training, resistance exercises lah.
The band, using the resistance band.
Something like that. Yeah. To continue to stretch the muscle, but of course not over the limit until it tears again lah. So I think like stretching will help with regards to all these tears, because your muscle will slow, even though after a tear, like your muscles will mend themselves lah. Like they will still mend themselves, of course, naturally. But of course, because it's torn before, so there's a higher chance of it being torn again, you see, because there's a crack there lah. So by stretching just nice, don't overstretch, then you can continue to keep, because we want to keep the muscles flexible. Because the more flexible they are, then the less likely it is to tear. Because as long as they are very rigid, then it will just very, very easily. So my advice is you do stretching, but light stretching for that particular muscle that you tore before. And then maintain it then, so that you can continue to keep using the muscle. Because if you use now and you're still experiencing pain, then it might not have recovered fully yet. Because muscles take very long to recover, very long.
But does a massage or twin affect aggravate it further, or does it improve?
That one I'm afraid I can't I can't advocate because
So
I can't advocate,
there are
but
like different schools of thought for the TCM or twin .
But as long as you don't feel pain, I think that's the most important . Like if you feel that it helps you, because I cannot jump into your body to find out. So each individual knows their body the best. Then if you feel that twin or massage helps with the managing the pain, then of course you can continue to go for it .
You won't aggravate. What I want to know, you won't tear further because
no usually won't Usually won't . Yeah, usually won't. But of course it helps if you let the person know beforehand that you have this particular muscle that is very sensitive, so they will at least keep will not exert too much force on it.
Okay, thank you, Mr. Tay and Joseph.
No worries. Thank you so much, May, for your questions.
Maybe you can just take one more question from SL, because she has been raising her hand.
Yes, thank you so much, SL. Thank you for being so patient.
Hi. Can I just check? Sorry, I was on the other line. Just now this May was asking about this breathing in and out. I just want to clarify. Let's say you're doing push-up.
Yes.
So is it correct to say that when you push away, you breathe out?
Yes, that's right.
It's correct, huh?
Yes.
And the other thing is, so is it okay about the climbing stairs? As in, if let's say we go down the stairs, is it okay such exercise?
You can go down the stairs, but I think it might not be that much of an exercise if you go down the stairs. If you climb 40 stories up and you go 40 stories down, the exercise level will be different.
Okay, but so I know, so you're trying to say that it's better to climb up, but
yes.
There's also this I'm not sure that people say sometimes when you climb up or you can't climb down, it will injure your knee. Is this theory correct?
I think my own personal opinion again, I believe the injury on the knee is more likely to happen if you climb down.
Oh, climbing down, huh?
Yes.
So can I just ask, I have this problem of my knee, especially my right side. I realized that when I climb up, I tend to feel a discomfort compared to my left knee. So
okay.
I did go for physio, and then to check. But the thing is, my question is, so my physio was trying to tell me that nothing serious, but I can feel, because it's your body, I can feel the discomfort compared to my left side. So I'm just wondering, like, for all this, because I went to see the orthopedic as well. So the orthopedic was saying that, I should stop like, squatting, jumping and all this. So my question is, if let's say I do still feel this kind of discomfort, so should I just stop everything, or is it okay? Sometimes when we do something, you feel some pain and ache, but you keep doing and then you will go off. So I'm in a confused state. Whether should I do or should I not do? What's your advice?
My advice is, so the pain is always there, or like on and off?
No, it's like on and off. And actually lately it's much better that at least when I climb, I don't feel that so much of discomfort. But once in a while, I can feel the discomfort when I climb steps. And I use the climbing step because that's the one that I can feel it. If I do other things like squatting or, I don't really feel the discomfort. But my orthopedic, the doctor was trying to tell me that, I should stop all the squatting exercise, even the jumping, or lunges and all this. Yeah, so that's why I'm a bit confused that, should I, because my physio was trying to say, no, actually old people, you all should do more of this, because you want to build on muscle. So, this one tell you do, that one tell you don't do.
Correct.
All right.
So my own personal take is, you can continue to do them, but light ones. So even when you're doing squatting, you don't do so many times, and then maybe you don't squat. If let's say your knee really pain, then your squatting angle don't go all the way down. Maybe you squat a bit, then come up, squat a bit, then come up, that kind of thing. Don't go like the mapu, that kind, the lion dance, that one, that one very can be the lion dance one, where they really go all the way down one. But okay but that one is
the
very
full squat. You're saying the full squat.
like a half squat, and then they hold it there one. So your knee, your leg is like 90 degree one. Something like that. So and then sometimes
so
also. Oh, sorry.
So you're saying don't do that kind or reduce the timing.
You can reduce the number of times, and then for the intensity, you can also don't go all the way down.
Okay. That is when I feel this period discomfort.
Yeah.
But if let's say normal time, let's say no problem, does that mean that I should be able to resume all this?
Yeah, really. Because at the end of the day, really your body is the one that talks to you. So if you really don't feel any pain, then by all means go ahead. But sometimes it also depends on external factors also. So like when your knee pain, it could be the particular flight of steps that you are climbing. Maybe the height of each step is higher, or maybe your shoe itself also. Because when we land our feet on the step, sometimes we all have our own way of walking. So we sometimes subconsciously we twist our ankle, and then we land our foot on the step. So that's why you are one leg okay, but one leg not okay. Things like that. So these factors are.
What is the correct way of climbing the step?
Correct way of climbing the step. That one I'm afraid I can't demonstrate to you here. But if let's say
what I mean is, do you when you climb, do you use your whole foot as in to rest on the steps, or sometimes we land like half a foot, and then is it like toe first, knee, heel first, or what?
For me, when I climb, I think my whole foot goes on the step.
Whole foot.
Yeah.
Okay.
But sometimes it is the angle at which you land, because sometimes your leg might your foot might not be totally facing straight. Like it might be angled to a side.
Okay, due to time constraint, I will have to be closing the session already. As mentioned in the chat, if you have any further questions, please message them at the numbers mentioned. So we will see you guys next week or the following week for the next session. Thank you so much for coming today.
Next week topic again?
Next week will be the same topic, but in Mandarin.
In Mandarin, yeah.
Oh, okay.
So it will be the following week, there will be an English session.
But different topic.
Same topic.
Yeah. for the
Following,
following
yeah.
week after the next, yeah.
Yeah.
Okay, thank you.
So sorry, SL, but thank you so much for asking.
Please send in your questions to the number
And
in
you
the
will
chat.
reply. You will reply, is it?
Yes, we'll reply to all questions sent.
Okay,
Yeah.
okay.
Thank you, everyone, for
Thank you.
your
Thank you.
attention and for attending our talk.
Bye, bye.
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 Thank you.
Thank you.
Thank you.